Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and critical area of veterinary medicine, an emerging adverse effect in cats undergoing treatment for feline infectious peritonitis, or FIP. This is based on a case report titled, Uroliths composed of antiviral compound GS 441524 in 2 cats undergoing treatment for feline infectious peritonitis from the Journal of Veterinary Internal Medicine, 2024. Feline infectious peritonitis has historically been a death sentence for cats. However, recent times have seen a surge in the use of non-licensed antiviral medications, obtained often through informal channels, that have dramatically improved the survival rates of cats afflicted with this disease. These medications, despite their unlicensed status, have shown promising results, offering a beacon of hope for cat owners facing this previously insurmountable challenge. Our focus today is on GS 441524, a nucleoside analog. It is a metabolite of the prodrug remdesivir and has become a key player in the fight against FIP. But like any medication, especially those used outside of formal clinical trials, GS 441524 is not without its potential downsides. This episode brings to light a previously unreported adverse effect, the formation of uroliths, or urinary stones, composed primarily of GS 441524 itself. We will explore 2 specific cases that highlight this phenomenon. These cases not only underscore the effectiveness of GS 441524 in treating FIP, but also raise important questions about its safety profile and the need for vigilant monitoring during treatment. Let's begin with the first case, an 8-month-old female spayed domestic short-haired cat. This cat was brought to an emergency service, exhibiting signs of dehydration, weakness, and lethargy. Months prior, a presumptive diagnosis of FIP with intracranial involvement was made, based on neurological signs such as seizures and altered mentation, as well as nonspecific pulmonary infiltrates and progressive anemia. This cat also showed hyperbilirubinemia and hyperglobulinemia. Following the presumptive FIP diagnosis, the owner turned to an online support group, FIP Warriors 5.0, to obtain an antiviral medication believed to be GS 441524. The cat was treated with subcutaneous injections every 8 hours and showed gradual improvement, with complete resolution of clinical signs noted during a neurology consultation a month after the initial diagnosis. For 2 months, the cat remained stable at home, continuing the injectable GS 441524 treatment. Around 6 weeks into the treatment, the frequency was reduced to every 12 hours. After approximately 3 months, the treatment was transitioned to oral GS 441524. However, about 13 weeks into the treatment, the cat began to show lower urinary tract signs, including hematuria. The primary care veterinarian identified ammonium magnesium phosphate crystalluria and diagnosed a urinary tract infection, which was treated with enrofloxacin. Upon referral to the Charleston Veterinary Referral Center, about 4 months after the presumptive FIP diagnosis, the cat's condition had deteriorated significantly. She was presented in lateral recumbency, showing signs of dehydration and hypovolemic shock. The reasons for referral included reluctance to move, urinary incontinence, and hyperexia lasting 4 days. Blood tests revealed azotemia, hyperphosphatemia, hypernatremia, hypokalemia, hyperchloremia, and hyperglobulinemia. These results were a stark contrast to those obtained just a month earlier, which indicated a much lower serum creatinine concentration. The cat was then admitted for treatment of acute kidney injury and shock. During the first 2 days of hospitalization, there was suspicion of recurrent neurologic and renal viral disease, driven by persistent altered mentation, non-ambulatory status, and continuous azotemia despite rehydration efforts. An abdominal ultrasound on day 2 revealed bilateral renal mineralization, mild loss of corticomedullary distinction, left-sided focal subcapsular hypoechoic thickening, right hydronephrosis, and proximal ureteral dilatation with multiple ureteroliths. The ultrasound also showed mild left pylectasia, renoliths within the pelvis, multiple ureteroliths in the proximal left ureter, multiple cystoliths in the urinary bladder, and multiple punctate hyperechoic foci within the urethra. Urinalysis indicated a low urine-specific gravity, proteinuria, pyuria, bacteriuria, and struvite crystals. Radiographs showed indistinct radiopacities in the urinary bladder. Given the grim prognosis and the owner's financial constraints, medical management for ureteral obstruction and acute kidney injury was initially chosen. However, On the fourth day of hospitalization, the azotemia worsened, prompting a re-evaluation of the treatment strategy. A repeat ultrasound showed progressive left renal pelvic dilatation. Surgical intervention was then offered, with a recommendation for bilateral subcutaneous ureteral bypass system placement due to the multifocal proximal uroliths, which the owner decided to pursue. During surgery, a cystotomy was performed, and the urocystoliths were removed and sent for analysis. The stones were described as sharply marginated, irregularly shaped, and amber in color. Post-surgery, the azotemia improved but persisted. The cat remained stuporous to intermittently comatose, with persistent pressor-dependent hypotension. On the ninth day of hospitalization, the cat suffered acute cardiopulmonary arrest and could not be resuscitated. Urine cultures taken before and during the operation came back positive for Escherichia coli. Initial analysis of the uroliths indicated an unidentifiable mineral. However, with clinical suspicion of medication-based urolithiasis, a reference standard of GS 441524 was obtained. Subsequent analysis revealed that the uroliths were 98% consistent with GS 441524. Now, let's turn our attention to the second case, a 2-year-old male-neutered domestic medium-haired cat. This cat was presented for management of urethral obstruction and recent weight loss. After sedation, the obstruction was successfully relieved. The cat's complete blood count showed a stress leukogram. Serum biochemistry revealed abnormal liver function test results. The cat was hospitalized for supportive care due to persistent inappetence. An abdominal ultrasound revealed peritoneal effusion and multifocal lymphadenopathy. Fine needle aspiration of the lymph node samples confirmed coronavirus via polymerase chain reaction testing. While hospitalized, the cat developed progressive neurologic signs. The owner obtained GS 441524 from the FIP Warriors 5.0 online support group and began subcutaneous administration. The cat was transitioned to remdesivir intravenously but was later switched back to GS 441524 due to progressive neurologic signs. The cat's condition improved and was discharged from the hospital. During hospitalization, liver function test results remained abnormal but resolved before discharge. After discharge, the GS 441524 dose was increased, and GC 376, another antiviral used off-label for FIP, was started concurrently. The cat's neurologic signs improved, but manual expression of urine was required. About 2 weeks after the FIP diagnosis, urinalysis revealed a pH of 7.0, magnesium ammonium phosphate crystals, bacteria, and unidentified needle-like crystals. A urine culture was positive for Corynebacterium amycalatum, and the cat was treated with amoxicillin/clavulanic acid. The cat was transitioned to oral GS 441524. Approximately 6 weeks later, the cat was presented to the University of Georgia Veterinary Medical Center for a weak urine stream. Urinalysis showed proteinuria, hematuria, and magnesium ammonium phosphate crystals. A urine culture was positive for Enterococcus faecalis. Ultrasound showed mineralized bladder sediment and a possible proximal urolith. The cat was treated supportively but developed azotemia, hyperkalemia, and hyperphosphatemia. A repeat ultrasound showed bilateral pylectasia, left ureteral dilatation with suspected mineral debris, nephroliths, mineral debris in the urinary bladder, and uroliths in the proximal urethra. The cat then developed progressive bilateral hydronephrosis. GS 441524 administration was changed to injectable. Subsequent ultrasound examinations during hospitalization revealed uroliths in the urinary bladder and proximal urethra, improved hydronephrosis and ureteral dilatation, and chronic degenerative renal changes. A cystotomy was performed to remove the uroliths and place a temporary cystostomy tube. The uroliths were submitted for analysis. The cat improved clinically and was discharged after azotemia plateaued. 2 days later, the cat was represented for a progressive clinical decline. A complete blood count showed anemia and leukopenia. Serum biochemistry showed static azotemia. Due to concerns about the overall prognosis, euthanasia was elected. Initial urolith analysis indicated 100% unidentified mineral. Subsequent analysis confirmed the composition to be 98% GS 441524. The analysis of the stones was conducted using sophisticated techniques. GS 441524 reference standards were subjected to Fourier transform infrared spectrophotometry, or FTIR, and X-ray powder diffractometry, or XRD, to establish reference patterns. The uroliths from both cases were then analyzed using FTIR and XRD, confirming their composition as 98% GS, 441524. Further confirmatory analyses were performed using ultra-high-performance liquid chromatography, mass spectrometry, and nuclear magnetic resonance. These cases highlight a critical, previously unrecognized adverse effect of GS, 441524 treatment in cats. Uroliths are a common concern in veterinary medicine. Struvite and calcium oxalate stones are the most frequently encountered. The standard techniques for urolith analysis include optical crystallography and infrared spectroscopy, with more advanced methods like XRD used for difficult cases. Medication-based urolithiasis, where stones form from direct crystallization of a poorly soluble medication or its metabolites, is a recognized phenomenon in human medicine. Antiviral drugs are among the culprits. However, it is relatively rare, accounting for only a small percentage of all uroliths. In veterinary medicine, reports of medication-based uroliths are even scarcer. Drugs like sulfonamide antimicrobials, fluoroquinolones, primidone, and doxycycline have been implicated. To the best of knowledge, uroliths composed of antiviral medications or their metabolites had not been previously reported in cats until these recent cases came to light. In both cases presented, the uroliths were confirmed to be precipitations of GS, 441524. This identification was made possible by the clinical suspicion of GS, 441524 medication-based urolithiasis and comparison with a laboratory reference standard. In the first case, the initial suspicion was FIP with renal involvement or acute kidney injury secondary to systemic illness from FIP. These findings suggest that urinary tract ultrasonographic evaluation should be considered in patients treated with GS, 441524, particularly at high doses, to check for uroliths. Contrast radiography may also be helpful, especially when ultrasonography is not available, given that these uroliths are radiolucent on abdominal radiographs. Because GS, 441524 is an unlicensed medication, a complete understanding of its safety profile in cats is still needed. In humans, remdesivir and its metabolite GS, 441524 are recommended to be used with caution in patients with impaired renal function. The fact that this complication has not been previously reported raises the possibility that certain predisposing factors, such as existing renal dysfunction, might make some cats more susceptible to forming these medication-based uroliths. Therefore, monitoring renal function in cats receiving GS, 441524 appears clinically prudent, with consideration given to reducing the dose or frequency in those with renal dysfunction, though further studies are needed. Several patient and drug-related factors might contribute to medication-based urolithiasis. Patient factors include a history of uroliths, obesity, urinary stasis, metabolic abnormalities, and urinary abnormalities like infection or altered pH. In these cases, it remains unclear whether infection predisposed the cats to urolith formation, or if the presence of uroliths contributed to the development of infection. Risk factors for obstructive upper urinary tract uroliths in cats include being female, having bilateral uroliths, and being young. The first patient met all these criteria. Both cats had crystalluria, lower urinary tract signs, and documented or suspected lower urinary tract infections, and both developed azotemia during their treatment. Drug-related factors include higher doses, longer treatment courses, high urinary excretion, low water solubility of the drug or its metabolites, and the size and morphology of the drug crystals. Because GS, 441524 is not a licensed product, the exact doses received by these patients are uncertain, and there is no standardized treatment duration. Marked urinary excretion of antivirals has been noted in humans, rats, and dogs. Solubility is a known concern. The use of an unlicensed product, particularly without veterinary oversight, adds further risks to patients undergoing FIP treatment. Additionally, one of the cats was treated with both GS, 441524 and remdesivir, and it is uncertain if this concurrent use contributed to urolith formation. Preventive measures used in human patients receiving antiviral drugs, such as increasing hydration, dietary modifications like salt restriction, and altering urinary pH, may be considered. Along with monitoring laboratory variables, including renal function and urinalysis, increasing hydration may be beneficial unless contraindicated. Renal histopathology by biopsy or necropsy in future cases could help clarify the role of crystal precipitation in the pathogenesis of acute kidney injury. Clinicians should consider screening for urolithiasis in cats that develop azotemia or lower urinary tract signs during GS, for 41524 treatment. Future retrospective or prospective studies could help assess risk factors and identify additional preventive measures. The authors of this study declare no conflicts of interest. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.